The member for Port Stephens.
Thank you, Mr. Speaker. Time and time again I sit in this place and I listen to the rhetoric of those opposite. Their attempts to rewrite history, ignoring the fact that they lost seats and a lot of support in rural and regional New South Wales. And I can understand why. Since 2011, when you formed government, overall unemployment in the Hunter Valley has risen from 5.8 to 7.3%. Youth unemployment has risen from 12.4% to an appalling 21.2%. These figures look bad, but I can tell you the reality on the ground is much, much worse. We have too many of our youth addicted to ice with no access to any drug and alcohol support. We have too many youth suiciding, having had no access to any mental health services, and community psychology services shut down by your government. We have high rates of domestic violence with no access to specialised women's services, local services having been defunded, and all emergency housing lost under the Going Home, Staying Home program, your program. We've already limited access to TAFE in my community, and now a community college lost funding under the so-called Smart and Skill program, and now they cannot deliver courses in aged care and childcare, both areas where we have local skills shortages. Following this government's complete privatisation of disability services, regional services will again be hit the hardest. And we have got a Tomaree Community Hospital, a regional hospital, with no X-ray facilities. You keep talking about these wonderful facilities that you're delivering in regional rural communities, and they are not there. They are not there. The one thing this government and its members have delivered, the one thing you have delivered in the Hunter is a deep sense of distrust. A deep sense of distrust in this place is in our communities because of the disrespect and arrogance shown by your members in our communities.
There's a CT scanner
Far from putting regional New South Wales first, this government's attitude is nothing but callous and uncaring to people in rural and regional communities.
Hospital for 10 years and not record spins on
Where is the social infrastructure? If we're talking about, let's look at how the economy is going in rural and regional communities. Let's look at the craneometer. The craneometer works really well in regional and rural communities. Should we look around and see the cranes? There is 21.2% unemployment. We've got no cranes. We've got no activity. We've got lots of reviews going on. But where is the social infrastructure? No mental health services. No emergency services. It's appalling and it's a disgrace.